Today I'm going to be doing a lesson plan over diabetes and its impact on occupational tasks. Alright, so first we're going to go over a learning objective. Of course, we always have one of these. So today's learning objective is, after the presentation, students will be able to identify 2 ways diabetes can impact a patient's daily occupations and 2 ways us as OTAs can aid them with those. Does anybody have any ways they know already that we can aid people with diabetes, patients with diabetes? Good. Okay. So to start off, we just have a short video just to get the basis of what diabetes is. So I'm just going to go into another slide really fast. Here we
Diabetes refers to a group of conditions characterized by a high level of blood glucose, commonly referred to as blood sugar. Too much sugar in the blood can cause serious, sometimes life-threatening health problems. There are 2 types of chronic diabetic conditions: type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Prediabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Prediabetes may or may not progress to diabetes. During food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is a hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induce glucose intake. In type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. Type 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent. In type 2 diabetes, the pancreas produces enough insulin, but something goes wrong either with receptor binding or insulin signaling inside the target cells. The cells are not responsive to insulin and therefore cannot import glucose. Glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Here again, genetic factors predispose susceptibility to the disease, but it is believed that lifestyle plays a very important role in type 2. Typically, obesity, inactive lifestyle, and unhealthy diet are associated with higher risk of type 2 diabetes. Type 2 is characterized by adult onset. Symptoms usually appear gradually and start after the age of 30. Type 2 diabetes accounts for about 80 to 90% of all diabetics. Management focuses on weight loss and includes a low-carb diet.
Alright, so that is the video that explains diabetes for us. I'm going to go a little bit more into depth for us. So we're going to go over the 3 different types of diabetes that we're going to talk about today. So type 1 is a chronic condition in which the pancreas produces little to no insulin. So this can definitely be a problem. And this can impact the patient's ability to do occupations in many different ways. And we will talk more in depth on that later in the PowerPoint. And then type 2 is an impairment of how the body regulates and uses glucose, which can also be a very big problem and cause many different health issues and problems in the future, which then affect the patient's occupations. And lastly, we have prediabetes, a serious health condition where blood sugar levels are higher than normal but not high enough to be diagnosed as type 2 yet. Alright, so a little diagnosis overview. Symptoms can be weight loss, weight gain, excessive urination, excessive hunger and thirst, along with fatigue. These can all be things that can be very debilitating while in work, in school, and play, during leisure and social activities. These can all be impacted and can make a big difference in someone's life before diagnosis, after diagnosis, or even if you compare someone with the diagnosis of diabetes and someone without the diagnosis of diabetes. Alright, so the onset can be type 1 or type 2 and may begin in adult or childhood, so it just depends whenever you are diagnosed, typically whenever you're younger though. The etiology is the pancreas makes insulin that regulates the blood glucose in the body. When the pancreas is unable to make the insulin, it can lead to diabetes. Or if it is able to make it, but the body could be unable to regulate that, like in type 2. And then the demographics is 34.1 million adults age 18 and older, or 13% of all U.S. adults have had diabetes. That is a big number. So, medical prognosis, healthy eating, regular exercise, weight loss, and blood sugar monitoring are all things that can help, that a patient with diabetes can do to help improve their diagnosis. And then occupation impact. As I said before, ADLs, IADLs, leisure, work, rest, social, education, and then play as well also is impacted if it is a child once they get diagnosed. So we have some questions. So how do type 1 and type 2 diabetes differ? So we have A, type 1 produces too much insulin. B, type 1 produces little to no insulin. C, type 2 is the body's inability to regulate insulin. Or D, both A and B. I'll give you guys some time to answer. So we can scroll down, and the correct answer is the type 1 diabetes is when the body produces little to no insulin, while type 2 is the body's inability to regulate glucose. So the answer is D, both A and B. Hope I covered it. Okay, number 2. Name 3 common symptoms of diabetes. Select all that apply. Weight gain, weight loss, hair loss, excessive thirst, blurred vision, excessive energy. Alright, so as you can guess, we have to pick all that apply, and answers may vary, but the correct ones will be weight gain, weight loss, excessive thirst, and blurred vision. So A, B, D, and E. Alright, question number 3. How is type 1 diabetes treated? Choose the best answer. This is type 1 diabetes. A, insulin injections. B, insulin regulation and medication. C, it is ignored. D, just healthy eating and activity. Choose the best answer. Alright, I'll give you guys some time. Alright, so the correct answer is going to be with insulin injections because they are insulin dependent. Their body does not produce insulin and will not be healthy if insulin injections are not made in the body, which also insulin injections can be one of the main reasons why main reason why diabetes can impact a patient's daily occupations, because having to make time for these insulin injections can be very time consuming and thought consuming, and just take up a lot of the patient's time and thinking. When discussing diabetes with a patient who has diabetes, he expressed that it's always on his mind whether he is having high blood sugar levels or low blood sugar levels. He is always thinking in his mind, am I experiencing symptoms that could be due to those? So he lacks the ability to really focus in. Not that he lacks the ability to really focus in on the tasks that he's completing in work or at school or education whenever he was younger. He's unable to completely focus in due to the fact that he cannot stop thinking about if he's experiencing symptoms, because it is healthy for him and safe for him to be thinking and always making sure he's not have high blood sugar or low blood sugar levels. Alright, sorry about that. Little tangent. So number 4 is going to be, what is one occupational limitation that diabetes can give to a patient? And number 4 is, answers may vary. There are many things that there are many different limitations of occupations that diabetes can sadly provide for patients. Just one is social activities. Many patients and people enjoy going drinking with their friends. Not even drinking like a crazy night, just a night at dinner and enjoying a drink with their friends. This can be hard because alcohol is not good for a patient with diabetes and can be it's very much told not to drink alcohol because it is not good for them and it will not be good for the diabetes, and it can have severe consequences. That is just one. Just to name another. And leisure activities, or say an IADL of watching your kids, raising your children. The patient that I interviewed says that sometimes it is hard because he could be in a grouchy mood or upset just because of his diabetes. Symptoms are acting up and it just puts him in a grumpy mood, if you will. And sometimes wasn't sure the difference if it was something that his kids actually did that was making him upset, or if he was just experiencing some symptoms that were making him upset. And it can be very hard to, like I said, he spends a lot of time thinking about all of his symptoms. It can be a hard time to really focus in on your children if you focus too much, not too much, but if you spend too much time thinking about whatever they're doing where you're watching them. It's even hard to think about yourself and really keeping a tally and keeping note if you are going in high blood sugar or low blood sugar. Alright, so here are the answers. And then one discussion prompt for us, I want us all to talk about, is how can occupational therapists help a patient with a diagnosis of diabetes? There's many things that we as occupational therapists can do. Just to name a couple is we can work on a routine with the patient, a routine that can improve their healthy eating, that can improve their diabetes. It can improve their exercise throughout the day. It doesn't have to be hardcore 2 hours at the gym. It can just be a little bit of daily exercise, saying going on a walk, just having some sort of activity each day that can help with that, because weight gain is a big symptom, is a very common symptom of diabetes. And once a patient gets diabetes, and then if they do get that weight gain symptom too much, it can be very difficult for them to, very easily and quickly for them to become a bariatric patient. And as we know, bariatric patients, once you become a bariatric patient, it can be very debilitating, and if you get too far in, you were unable to do lots of different occupations in your life, and everything that you did before is a lot more difficult. Working, physical activity is more difficult. Eating healthy is more difficult. Playing with your children, cleaning up your house, and taking a shower, self-care, everything can be a lot more difficult once you become a bariatric patient. And many patients with type 2 diabetes become bariatric. So it is very important for occupational therapists to work with patients if they are younger, to really work on staying active to, prevent from the weight gain, excessive weight gain. And if it's a patient who is older and who may have already gained the weight, it's really good to work on healthy eating to lose some weight, so their lifestyle becomes a little more occupational balance and they can do what they want and nothing can really be holding them back, as bariatrics and diabetes can do for some patients, but we want to be there to let them do what they want to do and not let their diagnosis define them. And that is all I have for you guys today. So I really want you guys to think about how occupational therapies can help a patient. That was just to name a couple. Occupational diabetes can impact the patient's all areas of occupation. So just really want to think about how it can affect the social life and how it can affect the work life and the education. I give you guys some ideas, and I just want you guys to keep thinking on that